Hi, this is a live session. I am Dr. Puja Kapoor, and today I'm going to talk about the first 100 days after you go for the diagnosis of autism spectrum disorder. So that means once you get the diagnosis, or even not the diagnosis, but if your doctor tells you that, okay, this is the first 100 days what you have to do after you don't even get the diagnosis, but your doctor tells you, okay, there's a hint of something wrong, there's a hint that could be there be some red flags of autism spectrum disorder. Why I'm telling you that even not before the diagnosis is because even if you have the red flags, you may land up at some point somewhere. So I don't want to mess up that. And that is why the first 100 days are very, very, very important. Studies tells us that, and also with our practical knowledge, we have seen that as the child is told about, as the parents are told about the child, about the diagnosis or the red flags, the first thing they do is ignore the diagnosis. Acceptance takes around 6 months to 2 years for a parent to accept that my child has got a problem. So that means that 50 to 70% of the parents take a period of 6 months to 2 years to accept that my child has any concerns and that you require a professional help for the child. And why I am telling you this? Because this is studied, and that is the most important time lost, because if you will not accept the diagnosis, you will not work on that. So your eyes will only see what your mind knows. That means you will only observe your child once you have met with the doctor. The doctor has given you certain things, and then if you start realizing those things but still don't do anything, that is the golden period lost. That time is all wasted because we are seeing children who have been diagnosed, not diagnosed, maybe red flags at 17 months. 17 months, the mother would come and tell, we see something stagnation. From last 2 months, he's stagnant. That means he's not picking up words. He's just speaking all the 4 words, 5 words, and that too, at times he is speaking, and maybe at times he is not. So that is the time you may approach the doctor. And if the doctor says, yes, there could be something, please don't sit on that. Because if you're going to sit on that, it's going to aggravate more. And by telling you don't sit on that, is that start working at least on something in the form of no screen time, in the form of some amount of professional help, ki what to do if I'm stuck. And third is that stop all the preservative food, take care of the fooding eating habit. And the last and the most important basically is engagement with the child. Even if you don't want to accept the diagnosis, even if you don't want, please just listen to your child, because your child is telling you everything by his activities. And if you suspect something, just start engaging the child and just stop the screen time. And if you believe that the things are getting out of your hand, please don't wait for years together to get to the help. Now, the second point is, it has been very well established that early intervention can give very good results. By early intervention, I mean as soon as you see whatever anything is going wrong, because a lot of our children have got the concerns of regression. So one third of the children with autism spectrum have the concerns of regression. The moment you start seeing the regression, don't go away, give it way that okay, it may resolve, it may just get better with day. Don't sit on that. Okay, just get and evaluate, just get and see, note down on everyday basis, yet you are seeing the stagnation and this is like from 15 days. Now don't sit on that. The other point is that after you have been put up for the red flags, you have not ignored, you have accepted something is wrong, start doing in the form of early intervention, because early intervention works wonderfully well, very well, if you have started it early. Now it has been said and we also have seen, the reversal can be much more easier and earlier with the symptomatology if we do early intervention. And by early intervention, again, no screen time, just constant engagement. And if you are not seeing the reversal of the things, please, please, please just go and take care, ask for the professional help. So a lot of parents, what they have been doing is like, because the child is not involving, they go to their hometown, let the child be, play with it on its own. This is not going to resolve the problem, because my child, if a child has red flags for autism, the child will not take interest with all the children around him. You have to grab the child and do 1:1 so that he may socialize with other children. The biggest mistake with the parents do is like, they know that okay, my child is not responding, not learning, let's go to a place where we could just make the child between the children, which should not be the case, because the problem is that the child doesn't know how to mingle. The problem is the child doesn't know how to get connected. So please make sure that you act as a therapist and do 1:1 interaction and try to gain in the attention of the child first, 1:1, and then just get one child along with, so that you become the pivot and the other child is here, your child is here, and you are making them up, our own child interact with the other child, because without your help the child doesn't know how to interact. So that's the next point. And believe me, this will really going to help. The next step is, please don't just put the child in the school, because school again is a group therapy. School is what? The teacher will give you the command, okay, twinkle, twinkle, little star. But if my child is not concentrating there, if my child is not attentive enough to look at the eyes of the teacher, maybe the teacher's effort would be wasted. So please don't just blindly put the child into the school. So school will help in the form of, maybe the child has auditory concerns, and once the child, madam, sings the song Twinkle Twinkle, he may look into the eyes of the teacher, but then only for a small while. So if the child is not improving to that extent which you are expecting, then please, school is not a great option. Because if it's at the very initial stage, very initial, when the child still has the connectivity, school might help. But if the child has lost the total connection from the environment, school is going to help you this much only, and my child required this much help. So school is going to help you only fraction of the point. So make sure, if the child does not have a good connectivity or only a mild loss of connectivity, then the child is good for the school. But if the child has a lot of connectivity issues, school is not going to help him, because it is a group therapy and my child require 1:1. So I believe the family members, if they take turns in doing, they would be able to help the child in a better way as compared to when I send the child to the school. Suppose if you want to know, I want to send the child to the school, then you go with the child, act as a shadow teacher, and help the child to connect with children because he doesn't know how to connect. Now, the next step is, now, after you have been diagnosed and you fully believe that my child has certain concerns and you want a professional help, start looking for the nearest therapy center around. So, the concern is that I don't want to put the child only because my child doesn't speak. So that is the first symptom which the parents notice, which I believe that's the most obvious symptom which you have, and rest other symptoms of lack of eye contact. So over here I want to make sure that you mind it. Lack of eye contact is inconsistent eye contact. That means if my child wants to play with the bindi which the mother is wearing, the child may give you good eye contact and you may get confused. Are ye to dekhta hai? No, that is the thing, because he's interested in the bindi there, and that's why he may look into you. Sometimes the parents say rhymes, and as the child wants to be interested in that rhyme, he may look up to you, and that also can give rise to, oh, the confusion. No, 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 my child has a good eye contact. So good eye contact means consistent eye contact. That means whenever you are connecting with the child or the child wants to connect with you, the child should give you eye contact. So the child wants to connect with you for his daily needs. Maybe he wants to go to the loo, maybe he wants to get the water bottle, maybe he is hungry and he wants to get that biscuit. He may not use just your finger to take you around. The child has to look into your eyes, and that is what we called as, the connection. So, looking into eyes is one of the surrogate markers of telling me that I want to get connected with you. So, that is the importance of eye contact. Eye contact is the first marker that before you communicate verbally to the other person, with your eyes, you can communicate with the person, and that is non-verbal communication, and that comes much before the verbal communication. That means before the child starts speaking verbally, the eye contact comes in, and that is why it is of very importance to understand that it plays a very good role in the connectivity, in telling me that the child is connected or the child is not connected. Even a lot of children who can talk also but would not give you eye contact. That is the point. Red antenna has to be raised in your mind that kuch to gadbad hai. Why my child is only looking intermittently towards me and not looking consistently towards me? Because there's a the whole word changes with intermittent and consistent. So make sure that your child is connected through the eye contact, which is a very important surrogate marker of your connectivity to the child. Now, we were on for the connectivity. Now, once you start doing that connectivity and you believe that, okay, my connectivity is not getting established, and I'm not able to get connected, that is the point you have to ask for professional help. Go for and look for the professional help. So what you have to do is, like, please looking for the qualified people who are going for the therapies for autism spectrum. So don't just go for the speech therapy, because that is the first point which you have picked up, but that is not the point which I am looking for. If I send the child to a speech therapist when the child is not connected with you, how would the speech therapist going to help you? He or she won't be able to help you if the child is not getting connected. So he may give you he may show you the pictures, but if the child is not interested, so the here comes the role of whether my child has got sensory concerns or no, and that is the point where you go for an occupational therapist or an ABA therapist. So mind it, directly going to the speech therapist is not going to help you much. Now, then what? If I have ruled out the school, if I've ruled out my family friends, if I have ruled out going to the speech therapist, so the other options are you have to give 1:1, and that is why I require a family. But people have to understand, only having a family is not going to help you. A family which is interactive on a 1:1 personal basis is the one who's going to help you. Not just leaving the child in the family is not going to help you. The next is, don't look for shortcut. Mind it, there are no medications for this. Mind it, there are no shortcuts for this. There is no gutti, there is nothing which you just make your child drink and my child become absolutely clean. So a lot of time we have seen that parents giving a lot of medication and thinking that the connectivity would improve dramatically. No, it's not going to improve. The core symptoms of autism spectrum disorder do not have any medication, full stop. The core symptoms would be helped only by the therapeutic intervention by the professional help and you. So make sure, don't look for shortcuts. Just don't blindly believe on any medication and don't do anything for your child, because just depending on the medication will help your child only 5%, 10%, but your intervention is going to bring a dramatic change in your child. So early diagnosis, acceptance of the diagnosis, knowing where to send my child, which therapy to start with, and not believing in the shortcuts. The next is, you have to go to be well versed with what my child is having. So you can go through a lot of doctors are making videos like this. So you can just subscribe to channels which you feel you are comfortable with, which are making sense, which are in sync with you. You are understanding the problem of your child. Subscribe to those channels and get help, and read literature from authenticated books. So that means that if you Google down autism in 0.18 second, you get 1 crore of the literature which is there. But not everything is, reliable. So there could be case control studies. There could be just few cases which said ki I give this herb to my child and my child become absolutely normal. So please don't go for shortcuts. There are no shortcuts. There are no shortcuts to that. Mind it, it is your intelligence and how you are going to deal with your child is going to make your child better. Please don't go for shortcut. So in the form of shortcuts, already stem cell has been stopped in India, and again there are other therapies for which there are a lot of research going on, and until and unless everything is proven, please don't just give it like that. Okay. And even if you want to give it, okay, as a parent, I believe you want to try everything. So the literature says as soon as the child is diagnosed, 76% of the parents go for complementary therapies. By complementary therapies, I mean which has not been studied, which has not been given much worth. Just a second. So, and which still are under evaluations, are called as complementary and alternative therapies. So please mind it, don't pay attention to that a lot. But still, if you want to do it, then what you have to do is, don't stop the therapeutic intervention which are already proven. If you get time, energy, then obviously you can spend on that. Okay. So that is what the gist of first 100 days. So first 100 days, obviously, if you know that you have some problem, first 100 days are spent on a very thought process. Sometimes you have dilemmas, sometimes your mind will say no to things, sometimes your mind will say yes to things, and this may happen. But please, for the first 100 days, make sure choose a path what you have to decide so that you can follow in the long run where you have to go. Set up your goals, set up your family problems, set up your friend, relative, your professional concerns, because you can write down that my child has been diagnosed or has red flags. I need to spend a lot of time with my family. So you can ask in for the letters, prepare the letters from your professional colleagues, prepare the letters for ask for help from your parents, from your grandparents, from your family, friend. Jot down the list of people who would be helping you in your long run. Write down the list of your relatives, friends, who you can ask for help for. Set down the duties. Okay, from 7 to 8 I will engage with the child, 9 to 10 mother will do something, 11 to 12 grandparent will come in. You have to set up all those things in your calendar, set up all your things in your room so that you have a plan ready. So first 100 days are for that. So to recapitulate, accept the diagnosis, try to do early intervention. If not, then start doing 1:1 therapy. Involve your family, friends. Don't let your child be alone in the family without any support of yourself. Doing 1:1. School may help, but not much. That make sure if my child is not connecting, school is not going to help you much at this stage. Next, involve your families, prioritize your work, get professional help from your colleagues so that you can write down letters and ask for help from that, maybe in a form of sabbatical, maybe in the form of some time duration which you can give to your family. Don't look for easy, fast solution. There is no such statement as that. And that is all to prepare for the first 100 days. Set your goals right and mind it, your child is going to be better. Your child is going to be better with that. Bring in a lot of positivity around. Don't go for negativity around. That's the most important thing, because if you're going to go for negativity, your child is not going to get better, because you're going to have that negativity serve to your child again. Okay, so I think that is all I have to say. And let us go to a few questions we have. So, Sobia Mazhar. Hello, ma'am, mera beta 3.5 years, ASD diagnosed, 3 months OT, a lot of improvement, and ज़्यादा घर पे ही काम करते हैं उसके साथ. So obviously, again, every mother can turn around what your child can. So घर पे काम होना is very very important. Understanding घर पे कैसे लें, क्योंकि उसका सिर्फ ओटी चल रहा है, ज्यादा टाइम तो वो घर पर ही रहता है. So देखिए, once you get the connectivity of your child with the professional help, so भी I'll answer in Hindi. So अगर जो है connectivity आ गई है आपकी, आप जो है इम्प्रूवमेंट बता रहे हैं, तो जो है हम जो भी बच्चे में बैकलॉग था, क्योंकि जो है हम 3.5 साल के हो गए, नॉर्मल बच्चे ने अपनी कनेक्टिविटी के थ्रू इस 3.5 साल में हर मिनट हर सेकंड कुछ इम्बाइब किया एनवायरमेंट से, बट हमारा बच्चा नहीं कर पाया, बट अब कर रहा है. तो हमें जो है जो पुराना बैकलॉग है वो खत्म करना है. उस बैकलॉग को खत्म करने के लिए हमें जो है सभी कुछ सिखाना है. वो आप कैसे सिखा सकते हैं? आप पिक्चर कार्ड के थ्रू सिखा सकते हैं. तो देखो, ये रहा एप्पल, एप्पल ला के बता सकते हैं अपनी नोज आईज, बिकॉज आपके पास तो 3.5 साल का लॉस वाला पीरियड है. तो जो है हम अभी हमें अंडरस्टैंडिंग बढ़ानी है, क्योंकि कनेक्टिविटी आ गई है, आप बोल रहे हैं इंप्रूवमेंट आ गया है, तो फिर अगर हमें वो बढ़ाना है तो आप जो है ऑब्जेक्ट आइडेंटिफिकेशन से शुरू करिए. मतलब ये नाक है, ये दांत है, ये होठ है, ये कान है, वट एवर, बट स्टार्ट विद ऑब्जेक्ट आइडेंटिफिकेशन से आप स्टार्ट करेंगे. जैसे जैसे ऑब्जेक्ट आइडेंटिफिकेशन आता जाएगा, फिर शब्दों पे जोर देंगे। बहुत लंबे लंबे सेंटेंसेस अपने बच्चे को मत दिखाइए, और अपनी आवाज को, अपनी उसको बुलंद करके उसको जो है दिखाइए, क्योंकि जो है उसको टाइम लगता है वो सारी चीज को कोरिलेट करने में। बट पिक्चर के साथ उसके साथ बोलते जाइए, पिक्चर बताते जाइए, उसका ऑब्जेक्ट आइडेंटिफिकेशन कराइए, उसके बाद अंडरस्टैंडिंग बढ़ती जाएगी। ओके, so next is Roop. My son is 2 years, 8 months old. We didn't do his assessment yet. He can say up to 300 words. He knows functional words also. He can name all family members. He can tell 7 days of week. Very good. 2 years, 8 months. Good. 12 months of year. All planet, colors, count, word, alphabet, spelling. ठीक है, एंड एक सेकेंड, उसके बाद जो है, एक मिनट, या, so he started pointing on books and to real object. His receptive language is also good, but he cannot communicate. No. So now you have to understand that he has got communication problem. Because if my memory is fantabulous, 2 years, 8 months, 7 days, week, 12 months, blah, 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 blah. So he's intelligent, he has a very good memory, but he cannot utilize this memory for social words. So please try to communicate. Just remove all this month, planet, name, color, sab hata dijiye. Please remove counting, number, alphabet. Just remove all this. Try to communicate. Communicate means कि जो है, चलो, as I've already engaged in the household work, talk to your child, get him to stories. So storybook with a picture. Oh, this is a cow and the cow is grazing in the pasture. So there is a lot of greenery there. So you make small sentences, use small sentences with the picture in that, and try to get those things, make him learn those sentences, and then put up questions from that. So where is the pasture? Who is eating grass? So the grass is eaten by whom? So you change in the pattern of the questions. Once you get the answer right, change in the pattern of the question. So who ate the grass? The grass was eaten by, and where was the pasture, and who ate the grass? So by changing the position, the words of the question, try to implement that, because that is what is going to help you to build up a social contextual vocabulary. Because wherever, whatever you have told me, there is no social vocabulary my child has. So social vocabulary can be reached by storybooks, by talking to him in small sentences. So mama is fine, how are you? So my day was good. How is your day? How was your day? So stop all those ratta wala cheeze and make talk with the child in very small sentences. If he is unable to answer, suppose he doesn't know what he has to answer by telling how was your day, to tell him, oh, your day was fine. Tell me, your day was fine. So by that, you are recreating that, putting that in his mind, and social vocabulary will build up. Now, this is the time when you require the family most, because this is the time when you require a child, because children imitate children in a good way. Because my child over here has got good absorption skills. Now, this is the time when if I leave the child with another child, just observe that he is imbibing or not. Suppose if he is not imbibing, then you get into that and ask, what is that boy doing? What is your friend doing? Is he playing? Chalo, let's play with him. So this is how you have to work and put up a lot of social vocabulary. Okay, so Roop, I think I've made it clear. Now let's Anupama Lalwani. Hello, hi Anupama. Next is Mamta Sisodia. मैम मेरी बेटी बातें रिपीट करती है बट आंसर नहीं करती है, क्या क्यों के जवाब नहीं देती है, अंडरस्टैंडिंग कैसे बढ़ाएं? तो जैसे मैंने रूप के लिए बोला वैसे ही आपके बच्चे के लिए भी है कि जो है जब भी हमारे पास वोकैबुलरी नहीं होती है हमें आंसर देने के लिए, हम चुप हो जाते हैं और हम वही रिपीट करते हैं। तो तुम कहाँ गई थी, तो अगर उसको आंसर नहीं पता होगा तो वो बोलेगी तुम कहाँ गई थी, तुम कहाँ गई थी, बिकॉज उसको आंसर नहीं पता। तो आप उसको आंसर बताइए, तुम दिल्ली गई थी, तुम दिल्ली गई थी, और उसको दिल्ली बताओ। ऐसे करके जो भी वो क्वेश्चन जहां पे वो अटक रही है या जहां पे वो वही इकोलालिया कर रही है या वही रिपीट कर रही है, उसके जो है आप आंसर उसको बताएं, समझाएं, और बार बार जो है बताने पर वो उसको दिमाग में उसके फिट हो जाएगा और उसको समझ में आ जाएगा अच्छा इसका आंसर ये है। ओके, अब आते हैं रौनक पे। Hello, ma'am. My 3.5-year-old kid has one word and he knows everything about surrounding. At 2.10, he has nothing like no name, no response. Wow. Wow, Ronak. So, just a second. Just a second. Just give me just a second. Okay. मैं कुछ काम कर रही हूँ, मैं करवा दूँ। Sorry. Okay. So Ronak, very good, huh? From 210 to 3.5, that means 7 months from nothing, he is showing interest in the surroundings. So wow, very good, very good. So now his question is, doctors have different opinions. Some says it's developmental delay, some say mild autism. He is very fast learner, means in 7 to 8 months he has 400 to 500 words, potty train, आगे he still has odd playing behavior and sometimes he does corner eye, means 1 to 2 twice a week. We are giving our whole time to him. He has good eye contact, name response is good. Screen time, especially TV, he is watching 3-4 hours every day from age 1. So Ronak, please try to understand there is a big overlap between developmental delay and social communication disorder. So from 2.10, where there was no eye contact, there was nothing, now you have moved to in 7 to 8 months you have reached that he's become interested in surrounding, he has become vocal, he speaks 300 to 500 words. Now what do you want? The thing is we don't want the right diagnosis because we there is so much of overlap between the symptoms of social communication disorder and developmental delay. So why you want to look in for the exact diagnosis, why you aren't working on the symptoms? Sometimes you're looking for the diagnosis is the wastage of time and energies, rather than putting up those energies where you are putting it right. You've brought so much changes in your child. So the fine thing is that as you grow better and better, the delineation will come in automatically. If my child would have intelligence problem and developmental delay problem, then my picking up won't be that great because your brain functionality is slow. He would not be able to recognize the colors, the alphabet, because in children with autism, they only 30% of them have cognitive problem, rest of them they are very well versed with alphabet numbers, they have a very high visual memory, but their problem is social. But over here, sometimes if mild social, mild cognition overlap, then you are in this situation as you are in right now. If you take my advice, don't look for the diagnosis right now. It will be clearer as the day passes by. try to get in all your efforts, which you are already doing because the results are fantabulous. Just put up all your effort in getting the child the symptoms which you are seeing, because 3.5 years, 300 to 400 vocabulary is less. Try to build up the vocabulary, try to do storytelling, try to send the child to school, because this child can go to school in a good way. And if you want to act as a shadow teacher in this school, that would be again fantabulous. And 1:1, just give a lot interesting things. And also you can involve play dates in the form of that, get one child and let your child imitate the other child, let the child absorb the language of the other child, and after the age of 5 years you can get the diagnosis. But if you will wait till 5 years for the diagnosis and then you start working, that would be too late. Okay, so don't go for the diagnosis. So next is Mariam. My daughter is 23-month old. She's not speaking yet, but speaks some word like kaka, tata, chehe randomly, and mama says when she wants something. She can imitate action but not imitate words. So now you have to define more. Now 23 months, 23 मतलब 2 साल, 2 years, I want at least 15 to 20 contextual words. Contextual, not randomly. So that means I have a cat over here. So my child has some problem. I will not overlook this problem, because randomly word puts up the antenna. So also I want to know, Mariam, about the eye contact, command following, because if all these are there, then you have to, there is something definitely, red flags are there for something, you have to better go in for the professional help. Okay. So autism is blessing. मैम मैं एक 4.5 years के बच्चे का पिता हूँ जिसका नाम नभ है. ओके, आई नो यू. आपके गाइडेंस से हम काफी आगे तक आए हैं. मैम क्या एएसडी बच्चे नॉर्मल पॉपुलेशन में मिल सकते हैं? सो मैंने एक एक जो है एक करा था प्रोग्राम डिस्कशन, जिसके अंदर जो है मैंने दीपाली के बच्चे से इंट्रोड्यूस करवाया था. सो ही इज लाइक अभी पढ़ लिख चुके हैं, जॉब कर रहे हैं. सो आप प्लीज वो वाला जो है देखिएगा सेमिनार. उसके अंदर जो है दीपाली डिमेलो करके जो है एक, जिन्होंने जो है जिनके बच्चे जो है अभी जॉब कर रहे हैं, इंजीनियरिंग कर चुके हैं, ही वाज डायग्नोज्ड विद ऑटिज्म. तो वो जो है अपनी जिंदगी अच्छे से जी रहे हैं. तो वो वाला वीडियो देखने से आपको बहुत ज्यादा मोटिवेशन मिलेगा कि अगर वो कर सकते हैं तो आप भी कर ही सकते हैं. तो प्लीज 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 वो देखिए, और जो है आखिरी समय तक भी जो है कोशिश नहीं छोड़िए, क्योंकि ये एक जिंदगी का सवाल है. ये पैसा नहीं है जो खो जाएगा तो वापस आ जाएगा, घर नहीं है, सामान नहीं है. दिस इज लाइफ, दिस इज लाइफ. आई विल नॉट इवन लीव अ सिंगल परसेंट. अगर मेरे पास होप होगा, मैं लाइफ को नहीं छोड़ूंगी. सो प्लीज, ये आपके बच्चों की जिंदगी है. अगर कुछ भी है, आप उनके ऊपर आपको काम करना ही करना है, बिकॉज ये एक जिंदगी का सवाल है. This is not a materialistic thing. This is our future. This is our children. So, Atul Singh, 2.5 years, after 2 months of OT, everything is quite better. But now he has a bit of self talk, still fidgety, hyperactive. He hits his friend at our house but plays very well at her place. सो कोई बात नहीं, 2 months हुए हैं, कंटिन्यू. बिकॉज सेल्फ टॉक आना अभी भी पूरी तरह सारे लक्षण ठीक नहीं हुए हैं. कीप वर्किंग ऑन ओटी, डोंट लीव ओटी. फिजिटी है अगर, तो इसका मतलब अभी ओटी का काम है. हाइपर एक्टिव है, इसका मतलब अभी ओटी का काम है. तो जो है ये तीनों चीजें जो है अभी हमें बता रही हैं कि अभी ओटी का काम होना बाकी है. हिट अगर करता है तो घबराइए नहीं. अगर आप बोल रहे हैं उसके घर में जाके अच्छा प्ले करता है तो वहीं छोड़ाइए, क्योंकि कई बार पेरेंट्स के देखा देखी भी जो है उनको लगता है कि चलो ज्यादा हाइपर एक्साइटेड फेज में वो कर देते हैं. उससे घबराइए नहीं, बट हाँ उसको बताएंगे कि नहीं करना है ये. ओके. और कुछ उसके ऊपर चिल्लाने की जरूरत नहीं है, मारने की जरूरत नहीं है, कुछ और करने की जरूरत नहीं है उसके साथ. ओके. सो एक मिनट. So, अब आते हैं गणेश. How many years will it take to confirm for stem cell therapy? So, Ganesh, I am not a scientist, I'm a doctor. So, yeah, there's a lot of things which are going on for stem cell, but right now it's still in a very, very early stages. Okay. So, I think we have done with whatever I wanted to convey. And thank you for listening and understanding your child and working like this. I am so happy to listen to all these things. Ki jo hai, the children are improving with 2 months of therapy, with 4 months of therapy. This is so good. So keep working for your children, work hard, and definitely the results would be there. Okay. Thank you so much. Thank you so much for listening.